So perform hand hygiene. Hi, my name is Abby. I'm a student nurse at HACC. Can you please have your name and date of birth? They would tell me their name and date of birth. Do you have any medical allergies I should know about? No? All right, great. Excuse me. So today I'm going to be changing your abdominal dressing. Is that okay with you? All right, so I would pull the curtain for privacy. I have all of my supplies that I need, so my tape, cotton swabs, gloves, a 4x4, and an ABD pad. I'm gonna go ahead, I'm just gonna lay them out real quick in the order that I'm gonna need them in. And then just a little bit of orientation for my patient. This is the patient's head and this is the patient's feet. So head, feet. Oh, and clean gloves. So the first thing that I would do is I would ask the patient if they're having any pain with their incision. They would tell me yes or no. And then I would go ahead and don clean gloves. And I would gently start to peel up the dressing. And get a grip on it. So I would peel up the corners of my dressing across the front, and then while pulling the skin away like this, I would peel up my dressing towards the patient's face so that if there was an odor under here, it would not be wafting into my patient's face. So then I would take this off and I would assess my bandage. So on my bandage here, I have some yellow purulent drainage that I would say covers 50% of my primary bandage, and then also covers I would say about 10% of my secondary bandage, my ABD pad. So 50% of my 4x4s, and then 20 or 10% of my ABD, and then I would just fold this and then dispose of this in the trash. And then I would take off these gloves and throw them away. Since my patient had some purulent drainage, I would just check his incision site then. And his incision site, all of his staples are intact. The edges are approximated. There's no gapping. There's no visible redness of any sort. And then there's no edema either. So there's that. So then going into my supplies here, I would perform hand hygiene again. So for my alcohol swabs, I would take and I would rip these starting from the corners, and I would go in like so. Be careful ripping to where the sticks are in the middle, and then I would twist and pull that off like so. Dispose of that, and then I would push up my sticks from the bottom, and then so they were up higher, so when I'm done with my sterile gloves, I have more that I'm able to grab. I'm just gonna take this tape off, just re-tape them back together. Just so it's not in my way for video purposes. So take them like this and then peel off a piece of tape. So I could tape these to the edge of my bedside table. So I'm gonna go ahead and tape them right here. So the next thing that I would need is my 4x4. So maintaining sterility, I'm actually gonna move my swabs down a little bit. So maintaining sterility, I would first grab a hold, start the edge like so, and then I would place that on a flat surface, and with these 3 fingers here, I would pull back on my packaging, making sure that I don't touch anywhere in the blue adhesive part of my pack of 4x4s, and that my 4x4s themselves don't jump over that border as well. So I have those, and then I would open my ABD pad the same way, except my ABD pad has already been opened. So I would do the same thing again. I would pull and then pull back completely, making sure not to cross my sterile field. And I would want to try and pull this back as much as I could so it stayed flat. So when I'm actually changing the dressing, it doesn't fall back over and then I break sterility. So now I'm going to open my gloves and don my gloves. I'm going to have to move down a little bit so I have the space to open my gloves. So away, forwards, side flaps. So now that I have my sterile gloves donned, I'm going to take my package of cotton swabs, which are taped to my table here, and I'm going to take one out. I'm trying to turn this. So I would take one out, and I would take it, and I would wipe straight down the center of my patient's incision, come out around my sterile field to throw that away. And then I would do the same thing again. I would go farthest first. So technically I'd be standing more like this on the patient. So I would go like this first, the farthest away, come out around my sterile field to throw my swab away. And then do the same thing with my last swab and go to the side towards me, come out around, and throw my swab away. Now, I held my swabs like this when I was coming out around. I wouldn't do that because I wouldn't want the liquid, the sterile saline that was on the end of my swab to drip down over my sterile gloves. So in actuality, I would have gone, if I would have swabbed down the middle, I would have gone like this out around my sterile field, keeping the tip of the swab down, not up like I had it. So now that my incision has been cleaned, I'm going to pick up my 4x4s and I'm going to pull them apart, and then pinching them like well, hot dogs. I'm going to drop one at the top and one at the bottom. Like so. I wouldn't really fiddle with it too much because my ABD is going to go on, but I had a really big mountain in the middle and I didn't want that to cause any type of pressure issues with my patient. So the next thing that I would do is I would pick up my ABD pad and I'd pick it up and move kind of quickly with it because it's going to flop open and I didn't want it to flop open and drag across my field here. So I'm going to do the same thing with this. I'm going to pinch it like a hot dog and I'm going to plop it down on top of my dressing. So at this point I would no longer need to remain sterile, but because my patient had that purulent drainage, I'm going to stay gloved for this. So I would remove my sterile gloves. And then I would don just regular clean gloves. And then I would take my tape and I would hold it, hover, approximate, rip, and make sure that at least half my tape was on my ABD pad, and then half the tape was on the patient. I'm gonna do my sides. And I'm also gonna make sure that my tape isn't wrinkled in any place as well. And then across the top. Too much, but I'll keep that little piece. And tape across the bottom. And I also want to make sure that my pieces of tape, they kind of overlap each other to keep the dressing more sterile. And then with this little piece that I pulled too much of off, I'm going to use my pen. And I'm going to write my initials, the date, which is 11, I'll just say it's 11/11. 11/11/2020. And then the time I'll say is 1840. And then I would take that piece of tape and I would put it, cap my pen obviously, put my pen away. And then I would just take that and put that on my dressing. So this is my dressing. I noticed that up here in this corner, my tape got wrinkled a little bit. So if that was the case, I would have to pull that tape off and put a new piece of tape on. But this is what it looks like. And then I would, after I was finished with my dressing change, I would ask my patient if they had any discomfort, if they were in any type of pain, and then I would lower my bed and give them the call bell and make sure that they were resting comfortably.